Hello again. Now, Soweto's Hani Baragwanath Hospital workers are staging a picket. They've raised concerns about budget cuts at the facility, saying this will lead to job cuts. Workers also say it will affect the quality of service that they are providing. My colleague, eNCA reporter Slindelo Masikane, was there and is back now in the studio to give us an update. Good afternoon, Slindelo. Thank you very much for coming into the studio. What did the affected doctors, for example, on the ground, tell you about their protest?
Well, what we know is that already, as it is, Hani Baragwanath Hospital is severely short-staffed. Now, in the height of the COVID-19 pandemic, what the Gauteng Health Department did was to release a number of posts to basically deal with the COVID-19 patients that were going to be coming in large numbers at the hospitals. And so these contracts were then advertised, and, doctors as well as healthcare workers were then hired at the various hospitals across the country to specifically deal with the numbers that were expected at hospitals at the height of the COVID-19 pandemic. This was in 2020. In 2021, these contracts were then renewed, but the news then made it to these doctors that, in fact, by the end of March, they're going to find themselves without jobs. And what the doctors were trying to highlight today with their picket was that their services are really needed at Hani Baragwanath Hospital, saying that already before the hiring of these 800 plus doctors, the staff at Hani Baragwanath were not coping as it was, and they were really assisting them in alleviating the pressure that comes at working at this very critical hospital. But let's just take a listen to what one of them had to say to me this morning.
We started with the word going around that there's a possibility that the contracts might not be extended, and until it was actually official, right? And so that's what we currently hear about. We don't believe that that's an inappropriate step from government, particularly from the Gauteng Department of Health. As one of the profs mentioned, Barra is currently serving not only this community of Soweto, not only Joburg at large, but as well as other provinces. Is quite heavily burdened at the moment with the partial closure of Charlotte Maxeke, servicing the other hospitals as well that are around. So, for government to actually terminate the contracts, it's quite insensitive, and I think, quite frankly, it's quite negligent of the government. The COVID-19 contracts were to actually serve COVID-19 patients, right? So patients who are admitted, with COVID, with COVID-associated morbidities, with COVID pneumonia, and etc. Right? So we are currently serving and managing the patients directly. Like I said, I'm actually overseeing one of the COVID wards here at Barra. So it's quite a crucial and essential service. As the prof mentioned once again, COVID is not yet over, and patients are still we are still in the pandemic basically.
I understand, Slindelo, you also spoke to Professor Madi. Of course, we know him very well here on eNCA and in the country, especially in the last 2 years with the COVID-19 pandemic. But regarding this matter, what are his thoughts about these possible job cuts?
So as the head of health sciences at the University of the Witwatersrand, Professor Madi, in fact, knows many of these doctors because, in fact, they are studying at Wits. And he was saying that, for the Gauteng Health Department to even consider these job cuts just speaks to the lack of leadership in that department, saying that, yes, the COVID-19 numbers are down. However, when it comes to healthcare services at all the hospitals in Gauteng, there is a serious lack of resources, and by continuing to, by even just, cutting these jobs that are so critical and so needed at these hospitals, speaks to the lack of leadership in the Gauteng Health Department, saying that there's clearly there needs to be an overhaul and a real look at who is leading this particular department. Let's take a listen.
It's indicative that this hospital patients didn't have bread for the past 2 weeks. It's indicative that this hospital biohazardous material is accumulating in this hospital, and not because the management of the hospital at fault, but because Gauteng Provincial Health is at fault for not paying the vendors to do something as offer basic supplies to this hospital. So this basically tells us is that the entire Department of Health, essentially Gauteng, yes, deteriorated to a point where it needs to be removed from the scene because it's incapable of managing the facilities currently under its ownership. So we need to relook the model in terms of the governance of these facilities until such time that there's greater political leadership in this province to ensure that our hospitals are not destroyed completely, because we're coming very close to that point. At this way, if these 800 staff are going to be removed, be rest assured the current health permanent staff are not going to be able to cope with the demands, and you're going to find permanent staff starting to resign as well, and that is going to compound the problem.
Hey, Professor Madi, they're in action, out and about, supporting those students. But finally, the Department of Health in Gauteng, any word from them?
Well, we did reach out to them and we did receive a statement from the spokesperson, Kwarakekana, and they speak of these budget cuts, saying that initially when these doctors were hired, they had a budget of around 2.2 billion, and that was for the 2020-2021 year. But now since then, that amount has been cut to 1.1 billion for the 2022-2023 year, meaning that they won't be able to keep all of the doctors that were hired, as well as other healthcare professionals. We're looking at around 8,000 posts that were advertised during the height of the COVID-19 pandemic. So it doesn't seem as though everyone will be without a job, but certainly a large amount of people will not have a salary by the end of March.
Well, it's not a good situation, because sometimes we are told here we need more doctors, we need more nurses, but this situation at Bara, not good. Thank you very much, Slindelo Masikane, for that update now.